Senator Scott Rupp, representing the 2nd Senatorial District in St. Charles and Lincoln County. I will skip the bio. Visit my website on the state page, all that pertinent information there. Check me out on Facebook for even more interesting stuff. It's my honor to bring before this committee a bill that you guys have seen before. This is Senate Bill 618, which deals with insurance coverage for families and children afflicted and dealing with autism. I am not going to go through a whole litany of information. I personally just wanted to start off and say thank you to every member of this committee, because last year you passed out a pretty much identical bill, unanimous, and that's kind of what got this whole issue rolling. So thank you to each and every one of you for that vote of support last year, coming out of this committee unanimous and then passing it out of the Senate 29-2, sent a very strong message from a policy standpoint that this is something that we want to see happen. The bill that is before you is substantially the same thing that you voted out last year, with some minor changes just on some of the provisions that maybe we had worked on over the interim or when we were in negotiations with the other chamber. But I just wanted to start off on why we are here. You know, the CDC came out with numbers the last time we were in this room. We thought that 1 out of every 150 kids was being diagnosed with autism. They have come out with new numbers in 2009. And that is 1 out of every 91 kids are being diagnosed with autism. In Missouri, the CDC says it's even worse. 1 out of every 83 Missourians. If you break it down that it affects boys sometimes more than girls, that's 1 out of every 52 boys in Missouri is what is being diagnosed, according to the CDC. We know that a lot of information has been put out there about what this bill would do. It would provide medical coverage and proven treatment, proven therapies that can provide such hope and progress for a lot of kids. The National Institute of Children Health and Human Development, the National Research Council, the American Academy of Pediatrics, the National Academies of Sciences, and other prominent groups have all listed that ABA therapy, which will be covered under this bill, has based interventions among all those recommended, which are treated for ASD. So all these groups say this is recommended treatment if you're on the autism spectrum disorders. We have some insurance companies that have said that it's the most thoroughly researched treatment modality for early intervention approaches to ASD, and recommend that early intervention in ABA therapy is the best way to address this issue. There's going to be a lot of testimony, I anticipate. I am going to just try to put a word picture of why we are filing this bill. In Missouri, if 1 out of every 83 of our kids were being kidnapped, there'd be a public outcry. Now imagine if you're a mom and a dad, and you go to your local police department, and you say, my son or daughter has been kidnapped, please help. And they look you straight in the eye and they say, sorry, it's not our problem. It's outside of our scope. We don't have to provide that service to you. You would look in amazement at why they would not be willing to help. And that's exactly what's happening today in Missouri, is that this disorder, autism spectrum disorder, is basically kidnapping a lot of our youth. And they're going to the recesses of their minds. They're falling into the blackness. And moms and dads are trying to rescue and reach their kids and communicate with them. And they're being told, I'm sorry, even though you pay your premiums, we don't have to help you. And this is something that's afflicting so many parents. We believe it is a policy decision. We believe it saves society, the state, parents, individuals money, because early intervention is key. And you'll hear from testimonies out there. You will hear testimony about what is the cost of this. Well, we have seen numerous studies, numerous states, other organizations that have done this, and their cost has been less than a 1% premium increase. That is less than a 1% premium increase across the board. That is something that has been upheld by other states, actuarial studies. You'll hear from the Department of Insurance. So we can actually put real numbers and real dollars to this. We think this is something that we need to move forward. So I will gladly answer any questions from the committee. If not, we'll gladly call our witnesses and move forward there.
Thank you, Senator Rupp. Are there any questions for the sponsors, Senator Rupp? Senator, just to add just a little bit more specifics within this, this is basically the version that some of us that were involved in this had put together in Doc Cooper's committee, correct? And I see Representative Wayne Cooper.
I would say this is actually a little bit closer to what we had voted out as a committee last year. The cap is what we voted out.
Right.
The small business exemption that we worked out in the House and Dr. Cooper's committee, that is there, so that's
That's
probably.
modeled after the mental health
The mental health
parity
parity, yes.
section, and that stays within this as well. Okay. Any other questions? And I just ask this as open-ended if anyone wants to comment on this. When I showed up in Jefferson City, I heard this new quote-unquote deal that this was going to be coupled to licensing of ABA and what that is or is not. I don't know if you've heard of that or want to say anything to that, Senator.
Yeah, thank you, Senator. There's nothing that deals with licensing in this bill. We believe that this first you need to pass the benefit before you can license people to serve it. But we're very open. We've had conversations with the department about licensing. Only 3 other states have a specific licensure requirement other than just kind of pointing to the national board certification, which is kind of where I think we should go. Is there's national boards that certify. We should just follow there rather than create our own little program. But it is my position, and hopefully the position of the committee and the Senate as a whole, that we deal with this issue, and then we run a separate bill through professional registration committee that deals with these types of licensing issues, and we get buy-in from the department, and we run that afterwards. But there's been no discussion of coupling those together.
Thank you very much, Senator. I'd remind our colleagues that I handed out an article about the state of Oregon, where lawsuits in the federal court have disallowed coverage for autism services